Hi, welcome to another session of A Patient's Perspective. Today I'm going to be talking about conversational styles between a patient and their doctor. And it's something I hadn't thought about too much until a few years ago, and I realized how much it impacts my care. I remember many years ago I had this wonderful doctor, very kind, gentle-toned, and he was explaining to me the risk of the surgery I was contemplating. It wasn't surgery I necessarily had to get, but something I thought about, and he was talking about the scar tissue and how that could be a problem. And I hadn't really known much about scar tissue back then, and he sounded so low-toned and gentle that I didn't take it really seriously. I'm used to, if someone has something really important to say, to talk in a little bit higher volume, a little more stern tone. So it just didn't seem important to me. It wasn't until many years later when I had quite a few of those surgeries that I began to understand scar tissue. Now, we can also have a situation how doctors proceed when you enter the office and they first start talking with you about why you're there and so forth. And what I really appreciate is a doctor who starts off by saying, "Now tell me why you're here today." Because I've had many doctors who just barrel right in and start talking about things, and you feel like you're never going to get your questions, especially in the short office visits we have these days. So what I usually do is start out by saying, "I'm here today and I have 3 questions, and I'd like to start with that, and then after hear what you have to say about this, what your thoughts are." And that way it leads the discussion a little bit better, and usually I find most of the doctors will listen better. And I will also toss in at the beginning that I understand they're tight on time, so they don't think I'm going to go on and on, because some doctors I found after my first question will still cut in and go off on tangents, and they don't have time for the other questions. So there's a real balance here to the patient needing to get out what they have to say, and yet leaving enough time for the physician to get their thoughts in. It's tough with the office visits being so short. Another thing I've come across is you have to decide if you have, let's say, a dentist who might be one of the top in the country, and you know their technical expertise is excellent. Maybe it's a oral surgeon specialist. However, you don't really like their personality, or maybe they're very egotistical, and I've run into that. You have to decide for you what works. Am I okay with a doctor that's great technically, but maybe their personality I'm not nuts over, and so forth. So that's something to think about. Another thing I've run into, especially at physical therapy appointments, is patients interrupting other patients. This is something I hardly ever hear talked about, and I've had this happen to me many times. Be lying on a the PT table, massage table, and the focus had been on me, everything's going great, and suddenly another patient or a relative of that patient yells out across the room to my PT about their concern, and it takes the focus off of me, and I'm thinking, this is my visit, this is for me, and I paid for this. So you have to speak up in those situations. Another thing I've run across is a resident once came into the room, and as I said in another video, I do appreciate residents in training. But what happened was, when this resident left the room, I could hear him in the hallway very close to the door relaying, kind of recapping what I said to the doctor. And the problem is, he wasn't really getting the story 100% right. And there were some important, what I call errors in the story, miscommunication. So when the physician came in, I told him that I could hear everything and what points that I felt were incorrect. So you have to learn to speak up as a patient and not be shy, because that being shy can really cost your care and affect your office visit. So that's very important, and don't let fear stand in the way. So these are some of the things that I've thought about over the years. So I hope you'll just think them through and see how in some ways this could help your visits, with knowing that we all have different styles of communication. Some surgeons may like to show things pictorially, and I prefer a verbal approach. I've had some surgeons just go off for a long time with their diagrams. I had no idea really what they were talking about. So you have to speak up for that too and tell them, hey, I prefer it in a more verbal way, or vice versa, whatever your liking is. So please give this some thought, and I hope to see you next Friday. Thanks for joining me. Bye.